Hi everyone, welcome to PharmaExplora. Today we are going to discuss another highly practical and essential topic, that is oral route of drug administration. So this is by far the most common and the widely used route of drug delivery in pharmacy and clinical medicine. So today we are planning to discuss how oral drugs behave in our body and also the specialized type of formulations like enter-recorded formulations, extended release formulations, and also the distinct advantages and the disadvantages of this oral route of administration. So without further ado, let's start today's discussion. Okay, in our previous discussions, we discussed what is pharmacology, and also we discussed that we divided pharmacology into two main disciplines, pharmacokinetics and pharmacodynamics. So we define pharmacokinetics in simple terms as what our body does to the drug, and pharmacodynamics as what drug does to our body. So if you missed these sessions and if you want to have a quick refresher, I have put the link down below in the description so you can go through those sessions as well. So however, we discussed before a drug molecule go to its receptor and perform its job, the it has to enter our body. First of all, it has to enter our body. So the routes available to enter to these drug molecules to our body, we discussed under the overview of routes of drug administration. So there we discussed the different routes available for drug molecules to enter our body. So we divided these routes of drug administration into three main categories: the enteral route, parenteral route, and the other routes. So enteral route, we discussed that enteral is the involving the gastrointestinal tract, and parenteral means the we administering drug into directly into the systemic circulation, or in other words to the bloodstream. And this other category the included so many different pathways like oral inhalation, nasal inhalation, then the intrathecal, intraventricular administration, then the topical administration, then transdermal administration, as well as the rectal administration. Now today we discussed this enteral route divided into three main methods: the oral administration, sublingual administration, and the buccal administration. So today we are zooming into this oral route of drug administration. So this oral route of drug administration is the most common, most convenient, most economical, as well as the safest the route of administration available today. So let's discuss about this oral route of drug administration. Okay, now we are going to discuss about the oral route of drug administration. So when we mention this oral route of drug administration, that means we are taking the medication by mouth and swallowing it so that it travels down our gastrointestinal tract and get absorbed. So let me repeat it again. When we mention this oral route of administration, that means we are taking medication by mouth and swallowing the medication so that it travels down the gastrointestinal tract and get absorbed. So this oral route of administration has two main distinctive advantages. That is why it stands out the one of the most safest method of or the route of administration today. So those two advantages, the first one is the ease of self-administration. The ease of self-administration. Now it means the medicines that you have to take orally or you have to take by mouth, patient can easily take this medication in the comfort at their home after receiving the proper instruction from their clinicians and the pharmacist. So these the oral route of drug administrating medications do not require the sterile equipments or the invasive needles, or sometimes the support from healthcare professional to administer particular medicines. Those things this route of administration do not require. So the ease of self administration is the one of the distinctive advantage of this route of administration. Then the second one is the greatest benefit this route of administration has. That is the overdose safety. Overdose safety means these medications we administer through our oral route of drug administration are reversible to some extent. Those are reversible to some extent. I hope you can remember we discussed in our routes overview of routes of drug administration lesson, the parenteral route of drug administration is irreversible. Why? Because we administer medications directly into the bloodstream. Here we use the gastrointestinal tract. Therefore, the medicines we administer through the oral route of administration is reversible to some extent. So that suppose if a patient accidentally overdose, or sometimes a patient experience acute toxicity for particular medicine, so that we have what we call the window of safety. Why? Because this medication takes time to absorb from the gastrointestinal tract. So within that period, the clinicians can introduce antidotes like activated charcoal, so that what happened, this activated charcoal goes to our stomach and binds to these excess drug molecules right inside our stomach, so that these drug molecules do not further absorb into the bloodstream through the lining of the stomach or the small intestine, so that it can easily eliminate from our body. So that is one of the greatest benefit this particular the route of administration has. So the reverse, because this route of administration reversible to some extent, therefore when a patient experience accidental overdose or the acute toxicity, the clinicians can introduce the activated antidotes like activated charcoal. So this activated charcoal goes through our gastrointestinal tract and absorb these drug molecules, and it prevents further entering these drug molecules, further absorbing these drug molecules to the bloodstream, so that it can safely eliminate these drug molecules from our body. So that is one of the greatest advantage of this route of administration. So because of this ease of self-administration and the overdose safety, this route of administration stands out as the most common, most safest, most convenient, and the most economical route of administration today. Okay, now we are coming to an interesting part. In our previous part, we discussed what is oral route of drug administration and what are its key advantages. So we identified two distinctive advantages, and we concluded that because of these two distinctive advantages, this oral route of drug administration stands out as the most common, most economical, most safest, and the most convenient route of drug administration today. But being the best route of drug administration does not mean that particular route of drug administration do not have any challenges. This oral route of drug administration is full of challenges. So we can interpret them as the disadvantages too. So those are the severe environmental challenges, the first pass metabolism, the food interactions, then the limited absorption, as well as the dependence of the patient compliance. Now first let's discuss about the severe environmental challenges. Okay, now we are going to discuss our first disadvantage of oral route of drug administration, that is severe environmental challenges. So we know the stomach maintains extremely low gastric pH or the acidic environment, making it easier for digestion. So because of this extreme low gastric pH or the acidic environment in the stomach, it can inactivate most of the sensitive drug molecules. So, because of the extremely low gastric pH in the stomach, it can destroy or inactivate the sensitive drug molecules. One good example is insulin. So, insulin is a complex molecule, large molecule. It's a fragile protein which easily destroyed by the stomach acid and digestive enzymes. Therefore, we cannot take insulin as a standard pill by mouth. So, let me repeat it again. So, we are discussing about the severe environmental challenges. We know stomach maintain extremely low gastric pH or the acidic environment within the stomach. Because of this, the sensitive drug molecules can easily inactivate. One good example is insulin. So, the insulin is the fragile protein which can easily destroyed by the stomach acid and the digestive enzyme. Therefore, we cannot take insulin as the standard pill by mouth. So, this is about severe environmental challenges that this oral route of drug administration facing. Okay, now we are going to discuss about second disadvantage. This is very interesting one. The first pass metabolism. First pass metabolism. That means before any oral drug uh, reaches to its bloodstream or before any oral drug can enter to the bloodstream and go to its particular receptor, it has to pass through the portal vein into the liver. So, before any oral drug can enter to the bloodstream and reach its receptor, it has to pass through the portal vein into the liver. So, I hope you can remember previous episodes we discussed liver is the main organ that metabolize drug molecules. So, liver there act as the gatekeeper. Now what will happen? Many drug molecules will metabolized significantly in the liver. So, before any drug can enter into the bloodstream to reach its particular receptor, it has to pass through the portal vein or into the liver. This liver act as the gatekeeper and it metabolized many drug molecules. So the many drug molecules will metabolized and this is significant. Because of this, the drug molecules which reaches to the bloodstream in its intact form is reduced. So, in pharmacological terms, we say it as this because of this first pass metabolism, the drug molecule's bioavailability will be reduced. The drug molecule's bioavailability will be reduced. So, we define the bioavailability as the rate and extent to which administered drug reaches to the systemic circulation in its intact form. The rate and extent to which administered drug reaches to the systemic circulation its in intact form. So in simple words we can say the amount of drug molecules reaches to the bloodstream to go to its receptor in its intact form. So you can see because of this first pass metabolism, significant drug molecules will metabolize and the amount that reaches to the bloodstream to reach its receptor will be significantly reduced. So that is one of the main challenge this particular route of drug administration faces. Okay, now we are going to discuss the third disadvantages of the oral route of drug administration. That is the food interactions. Food interactions. So, presence of the food in your stomach can affect the absorption of the drug molecules. So, the presence of the food in your stomach can affect the absorption of the drug molecules. How? It can delay the gastric emptying. Gastric emptying means the process of the movement of food from your stomach to the intestine. So it can delay the gastric emptying and also it can bind to the drug molecules and sometimes it can alter the local pH of the stomach as well. Therefore, the drug levels reaches to the bloodstream cannot be predicted or they are unpredictable. So let me repeat it again. The food interactions are the third disadvantage of the oral route of drug administration. So the presence of food in the stomach can affect the absorption of the drug molecules. How? It delays the gastric emptying. It binds to the drug molecules. Sometimes the food may change the local pH of the stomach as well. Because of these things, the drug levels reaches to the bloodstream can be unpredictable. So that is the third disadvantage of the oral route of drug administration. Okay, now we are going to discuss the fourth disadvantage of the oral route of drug administration, that is lipid absorption. So, if a drug molecule is too large or poorly soluble or highly ionized, those drug molecules cannot pass the lipid bilayer of the intestinal mucosa. So let me repeat it again. If the drug molecule is too large or poorly soluble or the highly ionized, so those drug molecules cannot pass the lipid bilayer of the intestinal mucosa and get absorbed. Therefore, such molecules shows the poor or erratic absorption. One good example is heparin. Heparin is the negatively charged drug molecule and it is also hydrophilic, poorly lipid soluble. Because of that, it shows the limited absorption. Therefore, we cannot give heparin as the standard pill orally. So, the heparin is a good example to explain the limited absorption disadvantage faced by the oral route of drug administration. Okay, now we are coming to discuss the final disadvantage of oral route of drug administration. So that is dependence of patient compliance. Now it's like this. Now, unlike the patient who is getting the parenteral administration in a hospital setup under the supervision of clinician, the oral route of drug administration entirely depend on the how much patient is remembering to take his next dose, his or her next dose. If patient forgotten to take the dose as prescribed, the treatment fails. The compliance is low. So that is one of the challenge faced in the oral route of drug administration. The dependence of the patient compliance. If the dependence is low, the treatment fails. So those are the basic 5 disadvantages that oral route of drug administration undergo. The severe environmental challenges, the first pass metabolism, the food interactions, the limited absorptions, as well as the dependence of the patient compliance. Okay, now we are coming to a different angle of our discussion. In previous part, we discussed the massive challenges faced by this oral route of drug administration. Now, the real question is, how do we protect our body from this drug, as well as how do we protect the drug from the body? The real question is, how do we protect the body from the drug as well as to protect drug from the body? To answer that, the pharmaceutical scientists developed so many formulations, the different type of drug formulations. Today we are going to discuss two different such formulations. So those are enteric coated formulation and the extended release formulation. Enteric coated formulation and the extended release formulation. So let's take one by one. Okay, first let's discuss about the enteric coated formulation. Enteric coated formulations. As the name implies, enteric coated formulations have a specialized chemical envelope applies to the tablet or capsule. So, this enteric coated formulations have specialized chemical envelope applied to the tablet or capsule. So, we can say this is our drug, and there is a special enteric coating outside the drug. So imagine this as a 3D structure. Okay, so this is our drug, and suppose now this is our drug. So there is a enteric coating all around the tablet or capsules. So that is the enteric coating. Now what happened? This enteric coating resists the extremely acidic environment in the stomach, and it protects drug within the stomach. And once the drug reaches to the small intestine, this coating dissolves and it permits drug to release in the small intestine. Let me repeat it again. These enteric coated formulations have specialized chemical envelope applied to either tablet or capsules. So this is, suppose this is the drug, and this is the envelope. Chemical envelope. So once the drug reaches to the highly acidic stomach, highly acidic environment, this coating prevents drug dissolving in the stomach. So this coating prevents drug dissolve in the stomach. Okay, so it protects drug in the harsh environment of the stomach. Then once the drug reaches to the less acidic small intestine, what will happen? This coating dissolves. This coating dissolves and allowing drug to dissolve in the small intestine and get absorbed. So this is the mechanism of the enteric coated formulation. So we use these enteric coated formulations for two main reasons: to protect the drug and as well as to protect the stomach as well. So we use this type of formulation to protect the drug as well as to protect the stomach as well. So let's discuss this one, to protect the drug. What do we mean by to protect the drug? Now, there are drugs that are highly sensitive to acidic environment of the stomach. So there are drugs, they are highly sensitive to the acidic environment of the stomach. So those drugs cannot be taken orally without this type of special coating, because it's going to be inactivated in the stomach. So for those drugs, for this kind of drugs, the acid labeled drugs, we use this enteric coated formulation. So one good example is the very common omeprazole. So omeprazole is very good example. Proton pump inhibitor, omeprazole. The proton pump inhibitor, this belongs to the category, pharmacological category of proton pump inhibitor. This omeprazole drug cannot withstand the acidic environment of the stomach. So they have the special type of coating so that it will prevent the dissolving drug in the stomach, and it transported to the small intestine. Then it will be the coating will dissolve and drug will get absorbed. So that is the good example for how we use enteric coated formulations to protect the drug. Then the second reason, to protect the stomach. There are some drugs which can irritate our stomach. Now, the good example is aspirin. Aspirin is the good example. This drug aspirin can cause gastric distress as well as the ulcers in the stomach if it dissolves in the stomach. Therefore, we use this enteric coated formulation, so this aspirin won't dissolve in the stomach and it will go to the intestine and small intestine and it will dissolve there. So that is the two distinctive reasons why we use this enteric coated formulation. So enteric coated formulation is the specialized chemical envelope applied to tablets or capsules which will allow or which will resist the coating to the drug to dissolve in the stomach, and it will allow to dissolve the drug in the small intestine once it reaches to the small intestine. So there are two distinctive reasons why we are using this the enteric coated formulation, to protect the drug as well as to protect the stomach. So this is basically what enteric coated formulations are. Okay, now we are coming to discuss the other type of formulation, extended release formulation. Extended release formulation. So it's like this. When immediate release formulations allow the entire dose of a medicine to release at once. It's like it's dumping the entire dose or the entire amount of the medicine at once to our body. So it will cause the sudden increase of the plasma levels of the drug as well as the drops followed by of this particular medicine, which is not a good thing. But the pharmaceutical scientist engineered the extended release formulations to utilizing special coatings or specialized matrix ingredients, so that will release the drug over an extended of period of time, allowing the slower absorption as well as the prolonged duration of action. So let me repeat it again. The pharmaceutical scientist developed this extended release formulation utilizing the special coatings or sometimes the specialized matrix ingredients in such a way that this medicine will release over an extended of period of time with slower absorption as well as the prolonged duration of action. So the medicine will release release over extended period of time. Over extended period of time. So this medicine will release over extended period of time, allowing slower absorption plus prolonged duration of action. Prolonged duration of action. So this extended release formulations allow slower absorption and prolonged duration of actions. So because of this unique characteristics, they have developed some clinical advantages. Those are smoother plasma levels, improved patient compliance, as well as perfect short half-lives, perfect for short half-life medications. So let's discuss one by one. Smoother plasma levels. As we discussed earlier, this extended release formulation maintains the drug concentration within tight therapeutic range over a longer period, because drug releases over an extended period of time, the absorption is slower and the action is prolonged. So they maintain the drug concentration within tight therapeutic range over a longer period of time, so that they allow smoother plasma levels rather than expecting sudden peaks and the drops. So it is a good advantage of this extended release formulation. The second one is improved patient compliance. As this medicine lasts longer, so the dosing intervals will be less frequent. So since this medicine lasts longer, the dosing intervals will be less frequent. So this medicine has to be taken less frequently, which is patient compliance is high. So it's like the patient do not like to take tablets 6 or 4 times a day, but he rather to take that particular medicine at once or 2 times a day. So that is about improved patient compliance. Then comes the perfect for short half-life medicine. So for short half-life medicines, you have to frequently uh, give the dose to maintain the therapeutic range. So for shorter half-life medicines, if it immediate release you are providing, you have to frequently provide the medicine. But if you can develop in such a way with extended release formulations, the dosing interval will be less. So very good example is morphine. So morphine we are taking for the chronic continuous pain. So usually the morphines, the half-life is 2 to 4 hours. So its half-life is 2 to 4 hours. 2 to 4 hours. That means you have to take at least suppose it's 4 times, so you have to take it 6 times a day. You have to take it 6 times a day to maintain the therapeutic range. But scientists have developed the extended release formulation of this morphine, so that you need to take it only twice a day, so that the patient compliance will be very high, and also it's easier it's very convenient as well. So the extended release formulation third clinical advantage is perfect for short half-life medicine. So we discuss about the extended release formulations. So we discussed that unlike the immediate release formulations, pharmaceutical scientists utilize special coating or specialized matrix ingredients, allowing the drug to release over extended period of time, which will allow slower absorption as well as prolonged duration of action. Because of this unique feature, it has three clinical advantages: smoother plasma levels, improved patient the compliance, and the perfect for short half-life medicines like morphine. Okay, to wrap up, today we discussed about the most popular, the oral route of drug administration. So we discussed that this is the most safest, most common, the most convenient, as well as the most economical route of administration available today. So today we discussed briefly about what is oral drug administration and also what are its distinctive advantages and also what are the distinctive disadvantages of oral route of drug administration. And also we further discussed the solutions that pharmaceutical scientists came up with to overcome these disadvantages as well. So I hope you have learned something from this video. So if you find this video helpful, just hit the like button and subscribe PharmaExplora channel and stay tuned for our next session. So thank you very much for joining with PharmaExplora today. See you soon.